Scenes like this were witnessed after Hurricane Melissa wreaked havoc on Jamaica in late October. Support for the island came fast and furious, including from Caribbean Health Access Consultants (CHA), even weeks before the hurricane passed through. Managing Director of CHA, Sammy, says earlier this year they signed a joint communiqué with Jamaica's Ministry of Health, pledging support in clinical training, AI diagnostics, and hospital planning.
So for the past couple of years, we have been collaborating with the government of Jamaica, giving them support in terms of both adult and pediatric cases that weren't able to be treated at the facility. So we've always maintained great relationship with the chief medical officer, the senior medical officers, as well as the specialists at Bustamante Children's Hospital.
Then came Hurricane Melissa. Mr. Sammy says the timing of the delivery was critical.
Where we agreed to give them support in terms of clinical competency, artificial intelligence in their diagnostics, hospital planning, as well as development. And we did a tour of the Bustamante facility with the chairman, Mr. Kenny Benjamin, as well as Mr. Anthony Woods and Dr. Dawson Richards of the hospital, where we saw where there was a need for some improvements.
Bustamante now handles up to 85% of Jamaica's pediatric cases. Mr. Sammy says the donation, though modest compared to the need, is making a difference.
Where it was in New Kingston, it was delivered the week right after the hurricane. So on that same day, I got a call from the CEO, Mr. Woods, who, along with Mr. Kenny Benjamin, who, they conveyed, the sincere thanks and the fact that with the devastation of Hurricane Melissa in Jamaica, a lot more of the pediatric cases are actually being brought into the Bustamante Hospital.
Caribbean Health Access sees this as more than disaster relief, but part of a long-term vision for regional healthcare.
Some of the areas that were impacted were impassable, and they actually had to airlift a lot of the patients into Kingston for treatment. So, it is timely, that this medical equipment, can be utilized to lend us much support. I mean, by no means 30,000 US is any great measure when you talk about the sheer size of the population. However, we were grateful that our contribution, was meaningful.
Caribbean Health Access says it is planning similar initiatives across the region, reaffirming its commitment to strengthening healthcare systems throughout the Caribbean. Sonolala, TTT News.